Okay, we've got a neat patient to show. We just got back some neat results. This woman is 61, believe it or not. She looks great. She lives in South Florida. But even though she looks great for 61, she's bothered by aging around the eyes. She's bothered by the descent of her face, some of these nasolabial folds. She's bothered by some jowling here, and she's bothered by the neck. So she did a lot of research for a couple of years. She went to 4 or 5 consults in South Florida where she lives, and then she found us. We had a long conversation on the phone. She actually flew in for an in-person consult, and then she chose us. And so we always are honored to take that very seriously. So we wanted to give her a great result. She had upper and lower eyelid surgery and a facelift, neck lifting, and some facial fat grafting, basically. And the goal of these procedures is to make people look younger. Take away some of the ears, do a younger version of themselves, with everything looking natural with totally concealed scars. So the way we did her facelift is our standard technique, which is a deep plane facelift. And this is some intraoperative footage here. Basically what we're looking at is the side of the face, and we have the skin lifted off of the muscle. And what we do is in a deep plane facelift, the critical aspect of that is to lift the muscular layer of the face. That's the deep architecture of the face, and that is what actually attaches to all the structures. So if we can lift that, release that, and reposition that, then we can get a powerful result and a long-lasting result and a natural result. So you see as we lift this, it's quite a complicated dissection. It takes a lot of experience and know-how because all the structures underneath the face are the nerves and the arteries and the parotid gland, etc. And so certainly you don't want to injure anything down there. But if you're able to mobilize that and understand and perfect that technique to do that, I always demonstrate this in surgery, you can really lift the whole face up and fixate it and then remove the excess skin and get a great result. So her surgery went great. She had a very smooth recovery. She wanted to do a video while she was here, and so it's interesting to listen to her impression when we asked about any advice for future patients. She is 11 days out from a full facial rejuvenation procedure. 11 in this video.
So some advice I would give to anybody that's considering the possibility is do your research, know where you're going, talk to your surgeons, talk to your doctors, and know that if you are to choose Premier, you're going to have a top of the line experience from the beginning to the very end, which I'm approaching my departure tomorrow morning. Everything's taken care of for you, the transportation, the food, if you need guidance as far as going out and getting things done, it's absolutely I'm so happy. I can't tell you how happy I am to have chosen Premier Care as my caregiver and surgeons.
So that's great. That's exactly what we want. We want a great procedure. We want a smooth recovery. You can see her less than 2 weeks after a facelift, and she's really got no noticeable bruising. She's swollen there, and then we'll see how that evolves. But that's the way we want people to feel. We want them to feel very happy, and then this is what we want to happen, is that 2 months after surgery, I've got her follow-up photos, and she looks amazing. Now, she started out in great shape for 61, but now we've rejuvenated the eye region, we've got the face up and back, everything's super natural. From the side, we can't even see the scars. Perfect, crisp jawline, beautiful neck. So that's taken 10, 15 years off of her age. She looks like she's around 40. So good for her. We're thrilled. She's thrilled she chose us, and so it's a win-win. Great case.